We are all saving lives. So when the services are taken away, I expect you will see deaths.
A stark warning from the city of Toronto after the provincial government announced it's cutting the number of overdose prevention sites. It is a blow to public health officials trying to battle the opioid crisis, and it hits very close to home for those who depend on these overdose prevention sites. There's one in Toronto's Moss Park that we spent time at last year, and so we decided to check in once again on a National Day of Action.
We have saved thousands of lives, but we could save thousands more. And so we demand of you to change the cuts, and you are no health minister.
Our kids, our loved ones are not bloody statistics. Shame! Shame!
People on the other end, on the decision-making side, they don't see the day-to-day of what people go through. They don't understand.
I always thought I was going to be, a doctor. I really did. I always thought that it was going to be a lot different for me. Yeah, I don't want to die in there.
I stole, I robbed, I did everything I needed to do to get my drugs. I feel horrible for it now, and I'm just trying to pay society back for my mistakes.
Essentially what we do here is we watch people inject drugs all day long. And there's times that, of course, we would need to respond to overdoses. We happen to respond to an awful lot of overdoses here.
Overdoses have increased. We've been experiencing more complex overdoses, more atypical overdoses, and the numbers are just rising.
Today is a rally and a march. It's a funeral procession to different locations, making demands on the provincial and federal governments. We need to stop having to fight. We really need to stop having to fight. Yeah. It's fucked up.
We're just going to keep dying until somebody does something about it. It sucks. Feeling a lot better, actually. And it's getting better. I'm going down, tapering off. I chose methadone just because it's a gradual process. It takes away the majority of the pain and the things that you feel withdrawing.
People are going to get hurt, and if not die, if they keep closing these places down. So hopefully today we can change some people's minds. I still have a job, I maintain it. I'm good at it, It's what I've wanted my whole life, is to help people, And I didn't really realize that until I got into harm reduction. As Mom told me she was proud of me for the first time in my life, and it made me feel pretty damn good, because I was such a disappointment when I was a kid, and I still do drugs, still put her through hell, but at least, I'm honest about it, and I don't hide it from my family anymore.
How are you doing?
I'm okay.
I'm so proud of Dave. So proud of him. And he's a person who has carried so much shame and guilt his whole life. And I can see him shedding that now as he's helping other people.
I'm getting sad.
They have rented refrigerator trucks in BC to cool bodies to store because the morgue is full. It's shameful. Drug users have rights, drug users have lives, and drug users are here amongst us. And we're here organizing and fighting for people's lives because this is about survival.
Life matters.
so many familiar faces here, and names and images of people that we've already lost. And then seeing some faces in the crowd that I've brought back to life. It sounds a bit dramatic, but
So now we will die. I invite you to die on the floor in any which way that you feel represents the people that you've lost, and to paint the gruesome reality that this is what will continue to happen should this continue.
well, ideally it'll end with people being treated like humans, people being supported in ways that are helpful for them. It has to be about lives. It is really emotional. Yeah.
For now, the Moss Park site will stay open. According to Canada's Public Health Agency, in the first 9 months of last year, more than 3,200 Canadians died of an opioid overdose. That's more than 10 people a day.